Hey guys, so I wanted to give you an update from my last video, and I told you I would, and plus I got some pretty good information here. Um, the last video where I left off was that I went to a life celebration of a coworker that did pass unexpectedly. He was one of the most welcoming, warming people, and made me laugh with all the, get well cards with my attempts to go back to work. So it was a good reunion too. And I got to meet up with managers and other, close friends. Like I have a friend that's close enough. I call her my work mom, and her husband's my work dad. So it was good and it was very welcoming. And I was very moved by the responsiveness of the company in supporting the family with this loss. As you know, sometimes you get good friends when you go to work, and that's essentially what this guy was. So moving on, I did have my appointment with my surgeon today, and it's about the spinal cord stimulator, which I also want to talk to you guys about. Um, it's actually, a pretty good thing if your doctor is trying to talk you into trying it. I would definitely give it a try because it can be removed as easily as it got put in. However, my case, I've been told by multiple doctors, is quite a rare case. And again, this is doctors, not myself. Like, there's doctors that are close to retirement who've never seen a case like mine, and it's just bam, 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 constant issues and new cases for me. So it was nothing the company could have done. It was nothing we could have predicted that would go wrong. So in my particular situation, I had this implanted, and they did do a 1 week trial to see if it was even going to work, and it did give me really good relief at first. It's basically electric aspirin and or opiate, but without the high, obviously. And the really interesting thing is that it has a battery that goes in your hip and it goes into your spinal cord, and the leads that go in talk to your spinal cord and your nerves. So you even have a remote, which I don't have mine with me at the moment, to control what nerves that your cord's going to talk to. And the agents, they were beautiful. They've been amazing. At first, if you do have a hard time finding that setting that helps you with your pain, I was able to reach out to them. And there were even times when I had to go to the ER and needed to talk to an agent. I got an answer that night. It may have taken a minute, but they also have on-call people. At least this company did. Your doctor may use a different company and their policies may be different. I don't know. But I wanted to show you. It is a good technology, and it's the same technology as the charger the device that you can just throw your phone on and it get charged. It's kind of like that. But here's the battery that charges, the battery that's installed, your power button, and then this right here tells you the signal that the paddle is getting, which is what charges. And yes, I am hiding the company information, but this is what charges your battery that's implanted in your hip. At least that's where they put mine. And then this right here tells you the life of the battery that is implanted in your hip. And depending on how dead it is, it could take forever. Now, mine did come with a belt, but I found it easier to just let it stick to my skin, sit down for a minute, let the heat from my skin. Yes, I did clean it, but I found it easier to let stick to my skin. I know quite a few people who have had it implanted and have had long-term relief, but mine stopped working essentially because I'm calling this issue the Jenga saga because that's what it feels like. It's, it started at the bottom and it's worked its way up, and it feels like I'm going back and forth. But part of the problem is, in my case, is where the leads are, or where they implant it and then the cords go, up through your skin, can't feel them. And then they go into your spinal cord and back down to talk to the problem areas. Well, after I had the stimulator implanted, I had another disc that went bad. And it was right where those leads are, right where they're going into my spinal cord. So that particular fusion failed because of the leads. In addition to that, one question, like if your doctor is trying to get you to try the stimulator, I would try it. Definitely, it can be removed. But another thing that you might want to consider is that the MRI locations, or the areas, the facilities that do MRIs that are close to me, nobody wants to mess with the stimulator patient. And I've actually had to travel to the only place that is covered by my insurance that will take care of a stimulator patient, which is quite a drive for me. And sometimes I do have to have help. In addition to that, you have to, well, at this company, and I'm pretty sure it would make sense for this to be an all across the board thing. You have to let your agent know that, hey, I'm going to have an MRI done on this day. And they would call me the day before, but I was in enough pain. I was like, can we do this the day of? Like, can my appointment's at this time? Can you call me between these hours? And they would do that. So, I mean, the service has been amazing. I did, again, I had to go to the ER and had to have that impedance check. And I was able to get a hold of somebody at 10 o'clock at night. This company particularly did have emergency calls as well. But the MRI staff has to have a handwritten note, or prefers that. And for your safety as well, it's best to have that. So I did have to ask for them to do that, to, provide me a letter I could print and or email it when I got there, depending on how circumstances went. If I was at the ER and they wanted to do an MRI, but hey, it's like, hey, I can't print that right now. Can I just forward the email address or just text it to you? And a lot of times they'll let you, maybe not. Just depends on who you go to. However, the reason that it's getting removed is because the cords in their location is actually blocking treatment. I did try to go for an injection, and the doctor was actually really amazing and he didn't have access to the ordered location of the injection to see if it could bring my pain down. So he had to go with the shot, which wasn't as effective. And again, this is nothing on the company or the doctors on why they couldn't do this. And it was actually my safety, because the doctor said I could go in another way, but your risk of infection is too high and I'm not doing it. You can't convince me to, but I'll give you a shot. It may help. It's less effective, but it's what I got and it's the option for now. So anyways, the surgery that I'm having is having it removed. And that's, just because, again, the problems are higher than what it is. But when I did get it, and before the problems became that, it was very, very well and worked very well. And in addition to that, because the cords are going in right where I had to have another fusion that did fail because the cords are present, they might have to do that fusion as well, or redo the fusion that failed because the cords are around it. So they won't know until they get there. So anyways, another good reason for the stimulator implant is you're showing your doctor that you're willing to try, whatever's out there, whatever options you have and what you can afford. Don't let it scare you. In my area and my experience only is what I'm talking about. I did have to go through a 7-day trial period. I did think it should have lasted longer, but the way they did that, it is kind of scary. So I'll leave that up to the doctor to let you know. But it was worth going through. And I felt an instant difference when they did take the cords out from the trial. An instant difference. So anyways, I wanted to give you guys an update. I don't know if when the surgery will be. I'm waiting for that for that phone call. But I wanted to let you know that if you are having disc issues or spinal cord issues and, pain from your back, try the spinal cord stimulator. Look up the statistics on it that your doctor does provide you, or even yourself, and see, what works best for you. And again, it does come with a remote, if I mentioned this or not. I've tried this video a few times, but I am hurting. It's been a long week already. But it does come with a remote, so you can control it on your own. And it's kind of interesting because the way the cords attach, or the way they touch, the way they talk to your spinal cord, it's kind of like a satellite. So if this nerve's acting up one day, you can put it on that one. You just got to play around with it. and the agents do help you with that when you first get it. And you can adjust the remote on your own. So anyways, I wanted to give that update, and I thought, I brought my boy in so y'all can meet him if you haven't seen the other video of what he's all about. We did get him so that he could be my service dog, to train him to pick things up for me, and help me with stuff that's on the floor. But I can't get on the ground to teach him, and we don't have the money to, teach anybody. So we're going a different direction, and we're going to try to get up to the children's hospitals to help, give a distraction to other people, and especially the children, because this kind of pain that I'm in and that I've been in, I can't imagine a child going through that kind of pain. We haven't made it that far yet, but we've been able to go to a local assisted living center, and he was just amazing there. He loves people. Sometimes I think he thinks he's another doll or another human. So, but I'll let you meet him again. Come here, Dees. Come here, baby. Come here. Diesel. Come here, sweetheart. Come here. Diesel. This is Dee. Come here, baby. If you see him. Nope, you're not on him. There he is. That's my boy. There's another video of him where I did do a little bit of a trick show. So anyways, if your doctor is, encouraging you to get the stimulator, I would highly encourage you to do so. You can always have it taken out, which is what this next surgery is. And again, we don't know if we're going to have to redo the fusion at that time or not. The doctor doesn't like to do multiple surgeries in one because the recovery time is very hard, but he may have to, depending on what the cords have done and what happened with that particular fusion. So anyways, if you're experiencing pain like this or pain in your back, glass half full. It's really hard, I know. But glass half full, what can you do? Try to keep a positive attitude, even though it's hard. And, if you know somebody who's suffering from chronic pain and you're not, don't take them lightly. Suicidal depression is very real. I did bring that up in a previous video. And I wouldn't be here today if it wasn't the, support of my family and the support of my church and even my doctors. I really wouldn't. I did have a day where I was ready to pull the trigger, and I promise you, you're not alone, and it's not worth it. And the only thing that suicide can do is, one, if you survive an attempt, then you are stuck with that injury for the rest of your life. And it'll also make it harder for you to get opiates in the long run because you're proving you're not mentally stable, and they can cause that issue too. So just keep all that stuff in mind. It's people, I've even got family members that have said, if, you want to end it all, you can. I chose not to because of my faith, and that is essentially my faith and my closest family are the reason I'm here today. And I'm glad that I made it through that. I really am. And it was a toss-up between an accidental overdose or pulling the trigger. So if you have somebody that cries out for help, they want to go to the ER, don't take it like drama, because it's not, okay? And I can tell you that if somebody does become truly suicidal, speaking from experience, they do get quiet. They stop talking. So if you know somebody who is struggling and they're not acting right, go check on them, okay? It's better to check on them and make them mad than to regret that you didn't, okay? So anyways, I hope these videos are helping you, and I am tired. I'm going to probably try to take the next few days for me time, but I just wanted to give you guys that update and let you know that there's options out there. You just got to give them a shot. Y'all have a great night.